All right, we'll go ahead and get started. Thanks everyone for joining us. July 22nd, we will have our incident commander, Aaron Kinnison, start us off, and then we'll go straight to Kevin Dick, the district health officer, for his update. And then we'll open up for questions after both of those briefings. So Aaron, if you're ready, please take it away.
Sure, thanks. A big thanks to everyone for joining us. We appreciate your partnership and your coverage of local government and our health district. As you're well aware, we face many challenges here regionally, our state, nation, the entire planet. Many challenges over the next several months between reopening the economy, business, schools, reopening our society in general. And at times it almost seems overwhelming. But I'll just say that, for me personally, I think it's more productive to focus on what can we do today. And to that end, the first point is we are indeed in fire season, as we have experienced over the last week, saw writ large yesterday. So I just want to encourage all of our citizens, now is the time to walk through those basic steps, make a plan, ensure you have a disaster supply kit, and that you're staying informed by paying attention to the media for hazards. Make a plan, assemble a kit, stay informed. Those words are as true now as ever, and I encourage everyone to do that because we don't know where the next fire start would be. The second thing that we can do today is think about your personal level of protective equipment, PPE. It is available today, thankfully, at the big box stores, online. So now really is a time to make sure that you have for yourself, your family, your basic quantity of PPE so that you can interact and go about your daily business and ensure that you and your loved ones are well protected. The other piece is we need to really pay attention to our social distance, to the wearing of masks, to being attuned to the needs of others in our community, neighbor helping neighbor. Just generally, we should be following the guidance of our local health authorities. And to that end, I will be followed by our health officer, Kevin Dick. Thank you.
Scott, did you want me to jump in?
Yep, go ahead, Kevin.
All right. Good morning, everybody, and thanks for joining us and for your help with helping us communicate with our community as we move through this COVID-19 pandemic. We're still working on compiling and we're still receiving lab results today, so we'll be putting out a press update later today that has the updated case counts of what's coming in right now. We're also today going to be putting out a press release reminding people with underlying health conditions of the heightened risk that COVID-19 poses for them, reminding them of this and the importance of them to be extra careful and be taking all of the precautionary measures that we're recommending. As far as where we stand as of the numbers that we released yesterday of 69 new cases of COVID-19, that results in our 7-day moving average of new cases being 75. Over the 4th of July weekend, when we were having some of our highest numbers of new cases, our 7-day moving average rose to a high of around 90. Since then, it dropped down to close to 60, And what we're seeing is we're on the uptrend again, with that number coming up to 75 new cases a day. So we have a big reservoir of COVID-19 that continues in our community, and fairly high levels of transmission with new cases occurring on a daily basis. Our total case count as of yesterday, 4,242. Sadly, we've been reporting additional deaths. We had 3 additional deaths that we reported yesterday, so we're at 105 people have lost their lives from COVID-19 in Washoe County. We have over 3,000 recovered cases now, 3,059. Our total active cases were at over 1,000 at 1,078. We had 65 people hospitalized, 320 released from the hospitals. We continue to have testing rolling in for Washoe County, averaging over 1,000 tests per day. The total number of tests reported, results reported from Washoe County as of yesterday were at 72,638. The hospital bed capacity and our hospital capacities remain good in Washoe County. We had 60% of short-term acute care beds occupied, 49% of ICU beds occupied, and 16% of ventilators in use. As far as the demand for testing, it remains high. We operated the post last Friday and had a record number of people that came through for testing of 665. We're operating the post today. This week we're operating it Monday, Tuesday, Wednesday, and Friday. And we'll be moving to 5 days a week next week, Monday through Friday, with operating the post. As a result of the numbers of people that are getting tested for COVID-19, not just here in Washoe County, but across the state, we are having delays in getting lab results reported back from both the state lab and commercial labs that are doing testing. That can be running 5 days to over a week. So that is a bottleneck that's occurring, and I think what we're seeing is a similar situation nationally on the testing front. We have continued to be working on staffing up for the personnel that we need for the testing, as well as the contact tracing work that follows the test results. And we have brought on about 30 new contact tracing staff over the last few weeks, and have been working on training them up. So there's a learning curve going on, and resources that are being expended to get that staffing up to speed right now, which is slowing us down a little bit, as well as with the guard planned stepping down at the end of July. We're having them work on winding up cases rather than assigning a lot of new cases to those personnel that are going to be leaving us. So we've instituted a protocol of notifying the positive cases when we receive their results, so that they know to isolate and that they do have COVID-19. But then it may be a couple of days before we have a contact investigator or case investigator actually be able to be in touch with them to get the information about their close contacts. But we're working on that, as I said, with bringing the new staff up to speed. We're also working with our jurisdictions, Reno, Sparks, and Washoe County, to be able to access some of the CARES funding that they have within each of their jurisdictions to be able to help support and bolster additional staffing for both the post operations and for that contact tracing effort. I think everybody is aware that the governor received the White House criteria for counties designated as red, yellow, and green. And he put out an announcement about that last Thursday. Washoe County and the city of Reno were designated as yellow. And because of that, we have been messaging to limit gatherings to no more than 25 people versus what previously had been directed by the governor of 50-person gatherings. So we're continuing to message that based on the elevated level of COVID-19 transmission that is occurring in the county under those criteria. And we did provide through the county an update to the governor on actions that we've taken and are continuing to work on to address our progress moving forward since we're under that yellow designation. So I believe those are the points that I wanted to touch on today, and I'd be happy to take any questions.
All right, thank you, Kevin. We did get one question in the chat box, which if you don't have a mic or you're having audio issues, feel free to leave it there. The question is from Kinsey Marjat. Kevin, how is wildfire smoke affecting COVID-19 symptoms?
Oh, thank you for that question, Kinsey. There's a lot going on, and smoke is just one of the other things that's impacting our region. And so with the smoke that comes from the fires, we know that is affects people that have respiratory conditions more than the rest of the population. And so with COVID-19, we expect that people that are suffering from COVID-19 have those respiratory symptoms. So we would expect that they're going to be impacted by that smoke exposure as well. The other concern with the wildfire smoke in the area is that even if you don't have respiratory conditions, it's still not good for your lungs and can inflame and harm your lungs while they're being exposed to that, which may make you more vulnerable for COVID-19. So I would just caution people to take those measures to avoid being outside in smoky conditions if you can, to try to avoid that smoke and the impacts it might have on you.
All right, thank you, Kevin. Any other questions for Mr. Kevin Dick?
Hi, this is Siobhan from the Reno Gazette. We're coming up on 3 weeks now, Friday, for the mandated masks. Do you think, that'll be a good indication coming up pretty soon that cases could drop, or if the masks are working? Should we expect to see, are all health officials kind of looking at, when that went into effect to see if there's a bump in, improvement?
Yeah, thanks, Siobhan. That's another good question. And from what we've seen in other countries that have instituted mask wearing, was that it did help with reducing the spread and driving their curve down versus other countries that did not. And so we hope and expect to see that impact from the mask wearing. I don't know how evident it's going to be immediately, because it's important to understand that we have the mask wearing. That's one thing, a point in time event that happened as far as the increasing compliance with that, with a mandate. And then we also had 4th of July that occurred where you'd expect to see some increases from gatherings, et cetera. So we have different effects that are superimposed upon one another. And so I think as we move through this week, we'll continue to watch and assess, kind of how those dueling factors may be playing out as far as avoiding a big spike that we might have gotten from the 4th of July. I guess I could add to that. I'm sorry. I just wanted to add to that. One of the reasons that we believe that we're seeing these spikes from gatherings that are occurring is that while people are wearing a mask when they're out and about, Then they get into a social situation with people that are from outside of their household that they're interacting with, and they're taking their masks off in that environment. And so I just would like to remind people that if they would keep using the masks in those settings as well, because of the principle behind it, that you're protecting each other when you're wearing the mask by preventing the spread of droplets when you're speaking and breathing, et cetera, that would help to suppress disease spread that might occur from those events. But again, we're really urging people to avoid gatherings and limit gatherings to less than 25 people.
I know when I've talked to some other health experts, they say it is those kind of personal gatherings and you don't go to a family reunion or something and wear your mask and shout across. Are the masks then working in businesses then? Are they working are the masks working in casinos? Are they working other places? Are you not in warehouses where, it's not a fun, friendly family gathering?
We believe that they are, if people are wearing them, as we've been recommending that they do. We don't have data, a scientific study that's going on in those locations, but from what we've seen with larger scale assessments of what the success of masks in other countries, et cetera, that's what we expect would occur here.
And then I have another one if somebody else is going to jump in. I know I asked you this last week too, and I probably keep asking it as schools are deciding what to do. And I know you have a meet, or maybe you had it with some of the school district officials today. If schools had to open, on Monday, what would your feeling be? And do you think in a month Washoe County would be ready to open schools?
It's very difficult with the changes that we see day to day with the levels of cases that we have and new twists and turns with the COVID-19 pandemic to know what we may be looking like a month from now. But as I said before, even if we had much lower levels of COVID-19 occurring in the community, I would be concerned with reopening schools, because that is just increasing the interactions that would be occurring if we have people physically going to school, with more people being closer together, not just the students, but the staff and the teachers, other support personnel, bus drivers, et cetera. It's an increase in the conditions that pose potential for transmission. As we all know, there are a number of factors involved as well, beyond just COVID-19, as far as educational attainment of students, the food that's available through the school programs, the interaction, children being able to be observed by others, those types of things. So it's a multi-dimensional decision and a difficult one, I believe, that the school board will be facing.
Any
Are there
more
any other
questions? Yeah, like Kevin said, are there any other questions? All right, we'll go ahead and end this, and we'll be back next Wednesday. Thank you for joining us.
Thank you, everybody.